Hey, welcome back to Boost and Balance Podcast,
where beauty meets brains.
We're going to do something a little different today. We're going to talk about the science of aging, but we're actually going to do a little demonstration. And we're also going to make over Becca's face because it's been a while since she's done filler, so it's time. We're just going to balance her out and we'll talk about why we're doing that. So as an injector, it's not about just poking somebody with a needle. It's crucial that you understand where, what, why, and how, okay? So we're going to start with why. Why are we placing filler in a certain area? It's because of 1, aging, 2, there's a deficit or something that is an imperfection or asymmetry that you don't like. But typically what we're doing is attempting to balance the facial features and lift those structures. So about at the age of 25, we start to reduce collagen, or we produce collagen slower and elastin slower. So what happens is our skin looks weaker. So as we age, starting at the age of 25, our fat pads shrink in our face, which causes the volume loss to look more apparent and the structures of the face to start to go downward. Then we lose elastin and collagen. That starts to deplete and those cells turn over slowly. So we've got the surface of the skin that's fighting for attention, and we've got the underlying layers that are fighting for attention. So this all really starts at the age of 25. So that's why preventative measures are such a huge thing in the younger generation, which is excellent. We're not trying to change their face though. I know you've seen recent things about Kylie Jenner and Millie Bobby that they look older. I think they're both beautiful, and if they feel beautiful, good for them. But you can age yourself more by overdoing it and getting a pillow face or making structures look more sunken in. So you want to follow your natural facial features and fix the depletions and asymmetry in a natural way so that it doesn't make the face actually appear older. It looks youthful and young. Okay, so we're going to start with Becca. We're just going to talk about some of the things that are happening and what we're going to do to fix that. So of course, when it comes to wrinkles, fine lines, she's got her tox, so she's doing good. But just natural movement of the face. There's 42 different muscles in the face. 22 of them or 23 of them are dynamic muscles that are expression muscles rather. So those are the ones we really pay attention to when we are doing our full face tox, so that we look natural when moving and younger. So, and then there's also ones that we treat. We literally put tox from head to toe, okay? We can put it anywhere for multiple reasons. But those are the main areas that we're treating. And then areas to give a lift. So she's got her tox here, so we are good here. The next place of volume deficit that occurs is the temple area. So this is an empty fossa here. There's really nothing there. So as we age, we get what's called a peanut head because that collagen elastin we're losing and those fat pads are shrinking, so it kind of goes inward like this. So we call it the peanut head because we got head up here, sunken in temples, and then the cheeks. And it's a place that's easily neglected because of that. So people will fill the cheeks and they'll still show signs of aging or look even older because now we have this indentation and hollowing here. If you look at a picture from 10 to 20 years ago, depending on your client's age, you'll notice that they were more rounded. A rounded face is a more youthful face. So her temples actually look pretty good. She could probably handle a little bit actually on this side. It's just her weaker side. We all have a weaker side. We are all asymmetric. People, one eyebrow's higher than the other, one foot's bigger than the other. Let's get down to the cheeks and the under eye. So there's a fat pad, there's a deep and a superficial fat pad right here in the mid face. And then there's a malar mound here, which is another type of fat pad. This fat pad actually will get more inflamed or swell as we get older. And then this one depletes. So what happens is the lower face then looks saggy and people assume their nasal folds and their jowling is where they need filler, but really the underlying problem is happening from this fat pad here. Then the under eye looks worse because now we have, no volume here and a fat pad swelling here. So it just causes this hollowing to look a lot worse. So fixing these structures in the upper face will then give structure back to the lower face and lift it. The goal is to use the least amount of filler in this area to keep the face looking natural. Plus it's a movable area and you want it to look natural when you're talking. Same thing goes when you're choosing your filler. And injectors, you should know your rheology and why you're choosing that filler and what area is a movement area versus one that's more structured like a bone. So there's so much more that goes into injecting than us just putting a needle in there and putting filler. Where deep injections for deep fat pads, restructuring those, superficial injections for superficial fat pads, a different filler for here than here should not be one filler. This should be a bone-like structure for lifting and structure. This should be a lighter filler for movement because you've seen those people with pillow face Typically they're using probably Voluma or overfilling that mid-face in that superficial fat pad, and they don't have any structure underneath that deep fat pad. So that's an advanced technique. You wanna make sure you pick the right provider for that. So today we're gonna give her a little structure in this mid-face, which she doesn't have a lot of volume on, she's perfect.
Stop.
So, yeah, I should be in the chair. And then when she smiles, and I call it the booty crack, you could see, first off, we've lost some elastin here and volume. So we've got to add volume back and lift that face. Okay, so then that's going to cover her upper face. Then we can come to the piriform if we need to. And just because, once again, that fat pad that's shrinking here and causing the lower face to look sunken, once we lift that, we may still have an indentation right here. So I'll come and pop that out if need be. So that would be her upper face. So very minimum in the nasal folds. Then we have what's called chin shadowing. So we have another fat pad. And so most of our fat pads shrink as we get older and sag, okay? We have a couple that swell, and they're the worst ones. We got the malar and the buccal fat pad. So this makes this look heavier, and then this makes this look more hollow. So we have to blend those. We don't want to put filler in that fat pad because it swells, right? And it's a hydrophilic substance. We don't want to add more swelling to an area. So we would come into this chin shadowing area and just give her lower face a nice natural lift. So from the side, there won't be any indentation. She really don't have much here. And then the other thing is facial balancing. Good chin goes a long way.
I love some chin.
So we want to balance, we want the nose, the lips not to overpower the nose or the chin. We want this nice balance here so we can afford a little bit more chin and lip just to bring her some harmony in her face and really balance that profile. So that's gonna be exciting. So signs of aging, it's gonna happen to all of us. The goal is to try to prevent those things from happening and build those structures back with fillers that make sense for that area and make sense for you as a patient. So we can always come in here and contour and make the cheeks look more lifted, but the goal is to also be resolving those underlying issues. And collagen stimulators like Sculptra can be beneficial as well. We can come in this lower face and tighten the skin and prevent laxity here. Smile for me. See some of these lines here that are forming? We can tighten that with Sculptra. And in the neck, we can even do Sculptra here. Most of us are impatient and we want that HA filler. We don't recommend treating, an area that we treated with HA filler for at least 9 months with Sculptra because risk of granulomas and things like that. So we don't want to wait. So we're going to go in there, we're going to lift these structures up with HA, and then we can save this for the Sculptra and then come back in 9 months and try to prevent those things from breaking down. All right, we're going to do it. Step 1. Yes, get your patient comfortable. She has numbing medication, a BLT cream on her lips, which is short-acting and long-acting numbing medicine, and we offer the Nox. Mr. Pro Nox.
He's the best.
Very popular man in town. Makes you not really care what's going on. So, first thing I'm going to do here is I'm going to stabilize her mid-face. Bring those facial features back up and add that volume back. So I'm going to come into that deep fat pad and add structure, and then I'm going to come to the superficial fat pad and fan out, and then get that under eye too. Okay, so I have reconstituted my filler. So I've got some bacteriostatic water in here because she draws fluid retention very easy under her eyes, and so I want to be careful with that. So I've just thinned it out a little bit. So I've already numbed her with Lido with Epi. You can see that white dot there. Some people are against it. As long as it's not in a structure where you're looking for a vascular occlusion, that you're keeping yourself safe. So I wouldn't put it anywhere here, obviously, because that's where that infraorbital foramen is. So I put it in a place that I know I'm not worried about. Now you do have that transverse artery, but I'm not going to get anywhere near that. So here we go. This is numb. So Lido with Epi. Okay, and I always kind of bend my cannula a little bit to just make it easier on me. So I'm going to do 2 clicks because I want to be in that deep fat pad. And I know I'm in that tissue plane. It's a little harder to push. All right, you good?
Mm-hmm.
So I'm just going to come here and bring some structure back. Good?
Mm-hmm.
So I'm in that deep fat pad, not that superficial. So I'm underneath there. Underneath that superficial fat pad. which a lot of times injectors are going into that superficial area. I'm in that submalar, trying to add structure back. Now I'm going to come up into subcutaneous tissue, which is right where that superficial fat pad is, and I'm going to come past here. There is a ligament right underneath that eye. I will have to break through. Okay, you okay?
Mm-hmm.
Now I'm just gonna come and blend this guy. Looking good. And I always start on the side with the most deficit because I'm not trying to chase a problem. I'm trying to match both sides and then enhance those features. So let's take a look. Still got some deficit right here. See if you can see that, but look at all that lift already just in that mid cheek. And a lot of times injectors will start laterally. I do that in certain cases too, but right now I am fixing features. I am balancing and adding structure back. So I'm actually working on that deeper tissue. So that's why I'm starting in the mid face, because I'm actually fixing structures. And then over here when I lift, it'll blend everything together. So it really just depends on what you're doing and what goal you're trying to reach with your client. Typically, it's going to be balancing and structuring, but there's not one way to do it. There's multiple, as long as you get to the end goal and keep your patient safe. Very petite face, so we can easily overfill her, and I don't want to do that. We don't want to dissolve. This little indention. I know, it's pressure. Good?
Mm-hmm.
Periosteum when I'm near orbital rim, because we don't want that filler to be too superficial. It's such a thin area. Now we're going to sit her up, and you can take a look at this side versus this side. Little poofy here, but not bad, but looks good. That under eye looks really good. Mid cheek is done on both sides. Under eyes are looking good. Now we are going to lift and contour that face. So come over here, and I'm going to add any sounds. So remember that booty I was showing you? That's what I call it. Little booty crack. Fixing that volume loss. So I need to come right here. I need you to come over just a little. All right, here we go. Mean. And I am on periosteum here because I am trying to act like bone with this filler. The other filler I did not want to act like bone because it's a movable area. This I do want to act like bone and provide structure and lift. And I am blending and now matching. She's very petite. I didn't start on the lateral cheeks and then attempt to blend the mid cheek. We don't want to overfill that. So I started mid cheek and now I'm blending everything. The apex of the cheek is where these 2 points meet, typically at that ligament. And I'm going to just blend it right there. Still good. All right, oh yeah, get up close to that. Can you show me what we're working with? Look at how that whole side looks lifted.
You can get with this or you can get with that.
We've got the cheeks filled in and lifted. Those fat pads are back where they need to be. We've got a nice contour going. She looks snatched, like she's running in the wind. So now we're gonna come to the piriform, which is that nasolabial fold. And we're very careful here because this is where arteries go from being external to internal. Those are those danger zones that can actually feed to those internal structures like the eye. But I avoid that by going down to the periosteum here and just popping that out. But we're also just very safe, always cautious with that angular artery. So turn towards me, and I'm going to go directly in here because I just want to pop that out. You don't want to overdo the nasal folds because it can actually accentuate them and make them worse. So I very rarely follow them through. I just come right here, and we are going to aspirate for good measure, even though that artery is more than likely superficial here. But nobody is like the book. We're just always going to play it safe. And we're going to do a 0.1 and then recheck our placement. It's very gross, I'm sorry. It feels like a lot of pressure on your teeth. And it can also make your lips go numb. I tell people, like, you're not having a stroke. It's pretty much like giving you a dental block. There is lidocaine in the filler, and we are right in that area that if the dentist was to come in, they'll come up underneath the gums and give you a dental block. So, which is good for her because we're going to do lips right after. So, it's just nice and smooth through here. Now, you are never going to be flat across. So you want a little bit of deficit. You want that piriform out. We're going to come over here and do the same thing to the other side. And then we're going to work on chin shadowing. Then we're going to take a break from that and we're going to work on lips because we don't want to do the chin before the lips. We always start from the top and work our way down. We're attempting to balance the facial features, keep them natural. We don't want to start here and come here, okay? Right, now that we've got the piriform nasal fold looking good, now I just went in there and popped the piriform out. I did not fold the nasal fold down. There's no need to. We don't want to accentuate that area. We want to keep everything blended. Now this buccal fat pad is giving a little attention down here to some just definition loss and volume loss here in the lower face called chin shadowing. So it's this little thing that makes us look like our lip is turning down and it makes this look like it's the problem. So we're going to just give that entire lower face a lift. And she just did her Pronox because this one is a little tough. Subcutaneous tissue here. Come across, there is a ligament there. Yummy, yummy sounds. And now I'm just going to add some volume in this little triangle area of volume loss and watch it fill. So get up close. Let's see. Look at that side of the mouth. This is her weaker side too. So now we look much more balanced. But look at her jawline over here. How it looks like we just went in and like, and we smack and then smile. Like this whole side. Looks great. So now jawline, just a little, it's all an illusion. We're just trying to blend these areas where we've lost volume and accentuate the areas that give us those beautiful contours. Okay. So we just completed one side of her lip. And I want you to see, what I did was I removed the filler from the rim of the lip with just small little aliquots of Hylenex, and I went underneath so that way I don't touch the area that I've treated right here and lifted the lip. So if you look up close, look at this side now versus this side. It looks natural. We've brought it back to life. There's no deficit in which there is here. You can literally see that little jelly roll where her fillers migrated some. And then this side looks perfect. Yeah. And you're gonna have people say, you do not do Hylenex and filler in the same day. You don't. If you're dissolving the lips, get rid of it. You do not want to put filler in the same area in which you are injecting filler, obviously. Hylenex will get rid of it. I am not injecting filler up here. I want filler nowhere near the rim of that lip, and I'm putting small amounts where I know how much travel it's going to get. Plus, I'll get her back in 2 weeks and we'll look and we'll make sure that it didn't deplete any other area, but I know anything up here, I don't care, it needs to go. So now I'm focusing on flipping that lip and bringing it back natural. So this is our filler, and I'm literally coming here. Like a reverse technique that we're using here, but we're still doing linear threading. And I'm using Rusty L. It's just a really pretty product. It's not too much because she's very petite. We don't want big old lips. We want them to look natural. Just bring them back to life. Order, it's kind of like if you're filling a glass of water to the top, that meniscus we call it. If you barely bump that glass, what happens? The water will spill out. So same thing goes in these areas. You know, they're very thin and it's a movable area. If the filler can spill, it's going to spill that way, right? And you see she's relaxed because she's numb and she's got Mr. Pronox here. So you just nice and chill. There's no need to be afraid. And when it comes to people asking if they can only get a half syringe, no. It's not about the syringe, it's about the type of filler we're utilizing. We need that full syringe to get the job done for the upper and lower lip. If somebody tells you they can do a half syringe, they're usually, that's gonna cover some lip lines maybe. But also if they're using a thick filler, they're not being an artist, they're not taking the tissue in consideration and choosing a filler that's best for your lips. They're just trying to put a half syringe to give you some volume. So it's not always about that. It's about getting the look you're going for and keeping it most natural. So that full syringe is necessary, and it just is the type of filler, whether it's thicker or thinner, that we're utilizing. Down. The goal is to give it that fuller look without too much projection. So we don't want to look like a duck. They're gonna be so pretty when they're. And don't be afraid to, if somebody tells you like you have to get your lips completely dissolved, like that's not a bad thing. It's just you're gonna get the results you're looking for. If your lip filler is fully migrated or it's the wrong filler in that area, we can't just put filler on top of it. It's just gonna make it worse. And then in 2 weeks when we put those photos next to each other, it's really amazing. So you gotta follow us. First, subscribe, and then follow us on Instagram, TikTok, Facebook. Be sharing this process. Doesn't look over accentuated, looks completely natural. So much better.
Oh, I love that.
So she legitimately looks like she's wearing a filter. No filler.
Stop.
But look at that. I mean, just like snatched, lips look great. Now we've got all of this fixed. We want to work on her profile. So now we've got the nose and the lips looking fantastic. We need to bring this chin out a little bit. And it's gonna make a world of difference. What I do is follow the patient's natural facial features. The nasal ala, which is a little bitty nose, the cutest little nose ever, is where my volume needs to lie to keep her looking snatched and V-shaped, okay? Here and widen this, it's gonna throw her facial features off. It's gonna make the lower face look more masculine. I don't want to do that. So I stay between the nasal ala. This is where most of my volume is going to go, and then I'll taper off and blend it here. But that's my sweet spot for my volume. For patient watching this, you know, some of these things, you know, aren't important to you, but as an injector, these are crucial. And this is what your injector should be doing, is mapping you out and making sure that your facial features balance your face, and what they're attempting to do makes sense for you. Not just because they do it on everybody. And if you show them a picture, there. She's starting to swell, so she's gonna bleed a little bit more because we've done worked on her whole face. And just aspirate for good measure because you do have arteries down here as well. I'm just gonna watch that chin. It's a little weird injection. It's a lot of pressure. Okay. Now we're gonna come over here and do the same thing. Stabilize. So if you pull off the periosteum while aspirating, well then you just did it for no reason. You're not gonna be in the same place. So you wanna stabilize, stay exactly where you aspirated. See, I lifted off right there. Now I have to re-aspirate. The radius in her chin. It's been a couple of years, but I can still tell that product's there. Into life. Okay, so I'm gonna skip through that so you don't have to watch all that injecting, and then I'll show you. I'm not going anywhere besides this right here, adding volume, and I'll show you what that looks like. Okay, so she's snatched up. Well, let's get closer. And we'll put the before and afters, but look at that. I mean, she looks seamless. Her under eyes, we went to lateral cheek lifted. We got in that deep fat pad, added that structure back, and then came to that superficial fat pad and blended. Went underneath that eye in that tear trough area and just made it seamless. So then we've lifted that. We added some projection to the lips. Not a lot. We just wanted to keep them looking fuller, more natural. We did do some dissolving here. And then we went to Paraform and popped her nasal folds out. And then we've snatched her jawline. Everything looks V-shaped because we've now added definition to the chin. And we came and did those chin shadowings, which lifted her entire lower face. There's no deficit here, so it makes that jawline look slimmer. And then look at this profile. Let's break her neck. I mean, I didn't even do any jawline, but it looks like we did. And I'm gonna attach that before and after video because oh my God.